Dogs are often arriving in the clinic where therefore they've already got some stress physiology and emotional responses happening inside them. Why might that be? Well, it may not be to do with us. It might be to do with what's happened before they've arrived at the clinic. Maybe they live with another dog where the relationship is poor. So this was a puppy on the right hand side who came to the clinic because he'd actually been attacked by another dog in the park earlier that morning. And so that dog, with the experience that that dog has just very recently had in the preceding minutes or hours, is already going to clearly be in a stressed response internally and have likely pain in their body. Maybe they live with an individual, a child, a cat, a dog they don't get on with. Maybe they have been chasing around in the park. And chasing around, whether it be squirrels in the park or the ball in the park, might sound like a lot of fun, but it still loads that dog with adrenaline, other catecholamines that drive fast responses like dopamine, and cortisol. And whilst adrenaline, we all know, can come and go quite quickly, be fairly quickly cleared from the body, then sometimes other elements of the stress pathway, like aldosterone, prolactin, and cortisol, can take much longer to be cleared from the system. Perhaps they don't travel very well, and maybe they've just had that car journey. Maybe when they were getting out of the car, somebody approached them in the in the car park, or even as they came into the waiting room and tried to touch them. And we'll talk about space invaders in a moment. Of course, maybe they are feeling unwell. After all, that's why many have come to see us. So they've already got pain in their body, or they've already got this infection. And if that is present, then of course it's likely that they come fueled with some negative emotional state. Maybe they haven't been sleeping well recently. Maybe that is because this we've just had fireworks the night before. Maybe it is because of the pain, discomfort, nausea, itchiness that they're in as to why they've come to see us. Maybe some dogs just, because for a whole variety of reasons, temperamentally find these unfamiliar, so not regularly experienced. I'm not confident with this settings more overwhelming than others. Perhaps, as we've just said, they've had previous husbandry experiences or previous context specific experiences, like coming to a vet for a previous examination, which is causing that conditioned response, which may well begin from the moment they walk through that front door. So practically, what can we do about all of that stuff? Because that's really what we want to know, isn't it? We may well recognize all of this, but what can we do? How can we improve the emotional well-being by reducing fear on the day? Well, some practical tips can be, think about the waiting room experience for many of our patients. We know that the waiting room is not normally the most ideal place for many dogs to spend their time. It puts them in close proximity to lots of other unfamiliar dogs who are obviously giving off their own odors, unfamiliar people. Is the floor particularly comfortable for them? What is the situation to move away from something they're finding overwhelming or uncomfortable? We often quite like the concept of clinics being, very clean and giving that appearance of cleanliness, which of course is really professional and important. But, sometimes that can mean things are quite bright for dogs. Dogs are at a lower level from us. They're using their nose, they're using their eyes, and quite a lot of the time, the odor from antiseptics, from cleaning products, from other dogs, the reflections they might get from brighter surfaces, all of those things can be really intense. And even a dog who is pretty chilled about much in life might find that quite overwhelming. So, if we recognize the limitations of the waiting room, can the dog just stay in the car until we are ready to see them and they come straight through the waiting area and into the consulting room? Perhaps we even start thinking as a practice of not even thinking about it as a waiting room anymore. We start thinking about it from a different perspective. And again, that'll be something that we'll be expanding on, options to be able to do that practically within the emotional well-being advice and resources webpage. Think about that flooring. And of course, that might be even more important to some dogs than others. If I have dogs that are coming in for pain assessments, chronic pain assessments, do we need to think about putting down an extra yoga mat or two? Or again, can they stay in the car for longer? What can we do to make sure that's really comfortable and clean and suitable for them? Research has shown that many dogs do not find going on the scales a positive experience. And that may be because a lot of the time to keep them out of the way so we don't bump into them, but also to make it easier to keep the dog on the scales, we tend to put them in a corner. And so now we're trying to get a dog into a small space, which for them is not very comfortable. Some dogs aren't very comfortable about that slight wobbliness or the type of surface that's on the scales. And so because we know that the scales are an issue, it can be really helpful to not put them on the scales the moment they come in the door. And yet so many of us, do promote that. And of course, I get that as somebody working in practice. Dogs come into my consult room. I've done the consultation. I'm thinking about dispensing some medication. And in order to give the injection, I don't know the dog's current weight. But actually, walking the dog out at that time to get their current weight is probably going to have been helpful rather than having weighed them from the moment of on arrival. Of course, we definitely can also think about the presentation of scales and how we've got them set up. Can we have ones that are set into the floor? What kind of surface is on there? Is there the opportunity to walk on and off easily rather than have them in the corner? How well can we get puppies used to the scales, when they are a young dog? And how much can the client prep them for that in a home environment as well? So again, lots of advice on those sorts of things on the emotional wellbeing page. When they arrive, it's very sort of human for us and social for us to go, particularly the I'm trying to be so welcoming reception team to go, oh, it's lovely to see you. Can I come over and give you a fuss? But space invading dogs, whilst it might seem like a good idea to us with great intentions, often isn't. So perhaps, saying to people, it's lovely to see you today. I'd love to come over and say hi to your dog, but I'm pretty convinced that actually right now they might like a little bit of space for themselves. So let's not touch them. Let's perhaps not offer them a treat. Because the treat thing sounds great too, doesn't it? And many dogs will take treats from reception staff, but actually we're luring them into our space. Many dogs would probably prefer it, if you're going to do that, you put it on the floor or you give it to their human and let their human give it to them as a positive experience rather than making them come into our personal space. It may be that we can think about things like pet remedy being present as an odour in the room itself. And that can be done in a variety of ways, through the wipes, through the sprays, through plugins. But perhaps we can actually just do designated waiting spaces. So if we can perhaps have a little barrier up so that dog's got some eye break, maybe we can just put it as a cloth or as a part of the mat in that space. And then they can choose how close or not they want to be to that odour. I hope you've taken the time or had the opportunity to take the time to come to the Pet Remedy stand and have a sniff, do the sniff test of the new odour, because it has been changed. The ingredients haven't been changed, but it's been dialed up and down in different ways to give it a different odour based on a wide variety of feedback over the last few years. So, I personally think the new odour is far more appealing. My opinion doesn't really matter. It's our patient's opinion that matters. And where I use it in my consult spaces, both in clinical medical practice, but also in behaviour consultations, I am noticing more dogs choosing to go over to a cloth that has the odour on and take some time to investigate it compared to before. So hopefully you've had the opportunity to do the sniff test. And if you haven't and you're listening to this later, then, let Pet Remedy know because we can get some samples out to you. Keep the human caregiver with the dog as much as possible, as long as that seems most appropriate. There are some people themselves who get super stressed about the fact that their dog's going to have an injection because they have issues with needles themselves, or it could be other elements of the examination that they're really, really uncomfortable with. They don't like the sight of blood, as an example. And, for that much smaller number of caregivers, then yeah, maybe them being outside the room and having the dog away from them can be helpful. But there's no reason why we can't bring something of their odour in with them. So can we have their jumper? Can we have the gloves they've been wearing? Can we bring their bag in with them so that there is some of their odour still present with the dog? But overall, research has shown dogs tend to have less of a stress response and a lowered heart rate and improved heart rate variability if their familiar humans, their human caregivers remain with them. So if we need to actually bring them into the practice, as this dog in this image has come in for a neutering procedure, then hopefully what you can see there in that situation is the owner's jumper has been admitted with the dog. We can think about a little bit of their bedding. We can think about a favourite toy. We can also, perhaps, if we feel we have capacity to do so, think about them bringing a bowl for their post-op water as well. There's an awful lot of dogs who don't want to drink from our disinfected, more sterile bowls. And also because although we've washed them, it is going to have the odour of other dogs on. We might not be able to detect it, but dogs can. And I know for myself, my own dogs will not drink from bowls that other dogs that they're not familiar with have drunk from. So sometimes for certain dogs, particularly dogs we know are likely to be more stressy, have fear responses in the clinic, bringing in a bowl for them of their own to have their water in post-operatively and or to be fed from can be really helpful. It can be helpful to think about the safety. A lot of the time, we're very aware that dogs can be flight risks, of course, and we might think about things like slip leads in order to make sure that we get that physical safety. But actually, we can achieve that physical safety through other equipment choices as well, things like really well-fitted Y-shaped harnesses. And I've worked in a number of practices where we have introduced Y-shaped harnesses, where dogs actually have the harness put on in the consult room with their caregiver present, and it's then that well-fitted harness that is used to lead the dog out the back. Even if sometimes we feel the need to add a slip lead as a backup, if some pressure is applied as the dog is a little bit more reluctant or goes to turn away from us, the first pressure ends up being around their body rather than around their neck. Because if they immediately feel that they've got pressure around their neck, which is such a vulnerable area, then a lot of dogs are going to start to feel emotionally and physically uncomfortable with that. If we're giving medications for procedures, pre-medications, sedations, it may be appropriate in some circumstances that the caregiver stays with the dog while that's given and as it starts to take effect. Sometimes we might be able to do it in the clinic and then return the dog to their car. Maybe we're lucky enough to have enough space that we can set up somewhere comfortable for the dog and the client to sit together with classic FM or something like that, quietly on the radio while that medication takes effect. And when the time comes to take the dog away from the caregiver, if that needs to happen because they're coming out for a specific test, they're coming in for a procedure, one of my top tips is always take the dog away from the human. Don't let the human walk away from the dog. When the dog feels more in control, that this is in part their choice to move away from their human, they always seem to feel better about that. So I always say to the human in the consult room or in the waiting room, you stay sat there. I'm going to walk your dog away from you. And once they're out of sight, then, please feel free to leave when you're ready. And I find that goes much better than if the human walks out of the waiting room or the consult room and then I try to move the dog away. That always tends to result in me having to put more pressure on the dog. And we've already, therefore, created some negative feeling for them. Loads of tips about this sort of stuff in the publication made by Rima in 2021. And then a recent study that was done in 23 did a lot of these types of interventions and showed that during a number of vet visits, the dogs where these interventions were put in place had less stress than dogs where these interventions were not present during that series of examinations. So, although it's not a huge amount of data, we are gradually increasing our ability to measure, record, and see the effectiveness of this type of approach. What about in the actual handling itself? What tips, practical tips, might we have there? Well, certainly where possible, one of my main tips for dogs and improving their emotional well-being experience in the clinic is to think about that game, the floor is lava, and spin it on its head. Because for most dogs, the table is lava and the floor is safe. And it might not be appropriate to complete the whole examination or procedure with the dog on the floor. And of course, if the dog's really tiny, like the Chihuahua, we might find, well, maybe that's particularly tricky. But the more time they spend on the floor, particularly at the beginning of the consultation, the better the majority of dogs feel. As soon as they're lifted up onto the table, they know that flight no longer becomes an effective option, particularly given the width of many of our tables. That they know that they can't move around very much. And as soon as you remove the ability of the dog to have the potential to move away, they start to feel more threatened and more nervous. We try to use loose handling where possible. So I like the phrase restabilize rather than restrain. So rather than trying to stop the dog, and physically keep them still, we're just using our hand as a little bit of physical support. We're allowing them to lean on us. We're just keeping them stable. But actually, if there's quite an intention for them to move, allow them to move a bit. The more they feel that moving away from us is an option, the less they feel the need to do it. And certainly the less they feel the need to escalate those distance increasing signs, and the less the stress responses internally are activated. A perception of freedom and choice is really preferable. Observe and respond. So go back to that body language, go back to that FAS scale, and what are we seeing? So are we in the green zone? Are we heading into amber? If I just take a few seconds pause, what does the dog offer? Does the dog offer stuff which starts to shift them further back down into amber and back towards green? Or is the dog actually remaining in high amber, potentially heading towards red? Little mini breaks, just sometimes, I use sort of a 3 second rule. I'll do something for around about 3 seconds and then I'll just pause and I'll move my hand away slightly. If I move my hand away slightly, just gives the dog the option to recognize, okay, they've paused. And then I think, okay, well, what do they do now? And if the dog looks towards me and is engaged again, then I will reoffer my hand and continue what I'm doing. And I often find a lot of dogs then will actually start to engage. They'll actually move back towards me to demonstrate, yeah, okay, I'm okay with this. Whereas if I don't put in those many breaks, then the dog really doesn't have that opportunity to show that. We can think, of course, also about the use of products to help make things more comfortable for the dog. So we can think about the use of things like EMLA or perhaps ethyl chloride if we're going to put cannulas in or for sampling sites. We know that EMLA takes at least 30 minutes to be effective, ideally more likely an hour. And so, of course, that might be appropriate if we've admitted the animal, so that we've put the EMLA on in the consult room with the client. And then, we're not going to be doing any more with that dog for another 45 minutes or so. But sometimes it might be that it is appropriate for us to dispense some of that to the client, for the client to apply before they come in, if we've perhaps pre-prepped them on what areas should be clipped, or the dog's even come for a pre-procedure check and we've just clipped that one patch or two patches on that day, and now they've gone away and they're going to come back on the day with EMLA having been pre-applied to that area. And I think this is really helpful also even for things like microchipping or for supralorin implants, where we're placing, large needles even in the scruff of the neck. We can consider just a little clip and some EMLA application there. The only thing, of course, to bear in mind if we're using a vapocoolant like ethyl chloride is that some dogs might find that a bit that might make them feel a little bit nervous anyway, because it's quite cold and has quite a strong odor. Clearly, I'm sure most of us would spray it onto a piece of cotton wool and then apply it to the dog. But of course, that's something also that needs consideration. Or if we're using a spray local anaesthetic, again, ideally to put it onto material rather than spraying it directly onto the skin, because many dogs, again, outside of the clinic experience, may have heard sprays, aerosols in the house, or even had some training done with sprays historically, which might trigger memories that are associated with negative emotions and experiences. Always fresh, small needles. We draw up what we're going to inject with one needle, and ideally we change, of course, because we all know how much the top of that needle gets deadened and roughened and damaged by going through the rubber top. So we change the needle for a fresh one. And what's the smallest we can use that's appropriate for this? We might also find in some circumstances that butterfly needles can be helpful, because actually once the butterfly needle has been placed, we can take a little bit of a step back and we don't need to be in their direct personal space for as long. There might be ways to positively and safely distract them. So this dog obviously in this image is licking some meat paste off of a licky mat. I find the licky mats which suction onto surfaces can be really helpful, because you can adjust it to height of the individual. And of course that may well be appropriate for the dog to engage with that while we are doing an injection or part of an examination or a dressing change. And of course, sometimes it might not be. And we'll come back to a little bit more detail on positive distraction shortly. It might be we can't use food for a variety of reasons. Or maybe the dog isn't hungry, maybe the dog's too nervous. So we might use something else. We might use a toy that's being, just sort of rolled gently or moved from one hand to another with the caregiver. It might be sometimes that I actually get the caregiver to be stood with their dog at the exit door and then just put their hand on the door handle to make a little bit of sound with the door handle as though we're about to leave. Particularly if I have a dog who's quite nervous about injections, because then they become really focused on, oh, are we leaving the room? And they don't even notice. There can be some negatives to using distractions, of course, so we do want to do it carefully, and we'll have a little bit more thought on that shortly. If we make good observations of the dog in the moment, one thing that we often learn is that the nose to tail approach, which has been so classically taught to many of us, isn't always the best approach for certain individuals. It can be really helpful for us from a memory perspective, because we know then we've gone from the front to the back and hopefully we've covered everything. But if we get ourselves into new routines, starting in the middle and going forward and then going backwards, will be just as effective to help our memory of what we've carried out in the exam, or start in the middle and go backwards and then go forwards. So starting in the middle is often preferable for many dogs, because as this image shows, most dogs are the most comfortable being touched over the upper shoulder, upper back region. And so if that's where we start interacting with them, and that's our first interaction, and it's more comfortable, it's more familiar for them, then that often feels better. Rather than the first thing we do is to lift up their lips and start looking at their dentistry and their mucous membranes and the mouth, which for many dogs is something they're far less comfortable with. So individualizing the examination based on the observations we see from that dog can be a really helpful part of improving emotional well-being and fear-less procedures. It's also worth considering a volume-sensitive approach, which is something again discussed by Martin in the publication from 2023, to use a touch pressure gradient. Some individuals prefer firmer touch over lighter touch. Some dogs might prefer a lighter touch over a firmer touch. And some dogs just prefer to start at a medium level and just keep that constant. So some dogs don't like that you've touched me, you've taken your hand away. You've touched me, you've taken your hand away. So that's what Martin refers to as the touch pressure gradient. Think about start with a lighter to medium touch and make observations. And then keep your hand there and move it along for some centimeters or inches, and perhaps increase the pressure gradually and then decrease the pressure gradually, so it happens in a gentle wave, rather than I've touched, I've removed, I've touched, I've removed. I think for me, you can still do those mini breaks where I do a little bit of touch, I give them a scratch, I do a bit more touch, I give them a scratch, and then I pause. I can pause with my hand on them, like in the photograph, or I can take my hand away and see how they respond. If we're using that FAS system, if we're green to early amber, then we're okay to kind of keep going. If we're later amber heading towards red, then we're not, and we should totally pause, give them a little bit of space, give them the option to take a break and move around for a moment, and then restart in an area where we believe them to be the most comfortable. It takes two in a consultation and an interaction setting. So we have lots of dogs that come to see us who are really quite tolerant of our strange, unfamiliar interactions. But of course, we have a whole host of individuals who come to see us who are not tolerant of that. They can't manage. This dog in the image on the right, an older collie cross husky, first started coming to see me because he'd become exceptionally aggressive at the vets, and nobody was able to touch him at all. We weren't able to at least place a muzzle on this dog because at the sight of the muzzle he would become extremely aggressive. He's really intolerant of interactions with unfamiliar people and with unfamiliar people who are vets. And that doesn't make him a bad dog, as we've said, and it doesn't make the tolerant dogs the good dogs. It's just that some individuals find this whole procedure more scary, more threatening, more negative than others. And it then becomes our role to work out what we can do to help support those in the most appropriate way. Tolerant individuals often demonstrate active coping strategies which help them. So it may well be for them that, well, they do a bit of sniffing if they're given the opportunity. They scratch themselves a bit during the consult. They're more likely to take treats. They're more likely to play with a toy, because actually all those things make them feel better. And because of that, that can often make it a bit easier to work with those individuals. We'll talk about shaping shortly, but it's easier to break things down into steps and pair them with positive outcomes if the dog is willing to engage in that way. If they're able to engage with certain things, scratches, toys, sniffs, food, it's easier to distract them. It may be that some of these tolerant individuals cope by going very still, and they're very still for some seconds, which makes part of our examination or procedure easy, and then they recover quite quickly. Oh, it's all done, and you can see them shake it off, and then they're willing to take the treat, and then they seem fine. And we've all met many of those individuals. The difficulty often becomes with the individuals who are less tolerant. These also often demonstrate active coping strategies that keep them safe from the handlers. But what they're doing is they're often using increased distance increasing actions. They have shifted to the loud, shouty, screamy part of the conversation. Because they're in a higher stress state, a lot of these individuals won't take treats, which can make working with them much, much harder, which is what had happened with that Collie Cross Husky from the previous slide. Or, of course, we've probably all met dogs as well who snatch and grab. They become very, very snatchy. We can't use the taking of treats as a reliable indicator that this dog feels okay. There are many individuals who will still take food, but they do not feel emotionally okay at all. These not so tolerant of our interaction dogs often aren't easily distracted because they become super vigilant about what we're doing, and their sole focus becomes on us. And that means that we're not going to get away with giving them a licky mat, playing with a toy, or even playing with the door handle because they are very aware of what we're doing. They're looking for the predictors and they're looking at, well, how on earth am I going to communicate that to this individual who I don't believe is listening to me? These types of dogs often have poor recovery times. So if they do go into a freeze, then they may stay in a freeze for quite a long time. And they're the kind of dogs, we've got them out on the clinic floor and we've done something to them and now they won't get up off the floor to go back into their kennel. And some, picking them up and lifting them in might not even be practically appropriate. But even if they weren't too heavy, it significantly can increase the risk of bite responses because the dog's now in a much more intense stress state. These individuals might go into a marked panic response. So they might really start escalating their flight attempts, which can make it quite dangerous within the room. And also the likelihood of them injuring themselves or actually getting out of the room. And all of these, these more the coping strategies where they're not well applied and they are intense are maladaptive because it can mean that those individuals have higher stress levels, they're more likely to hurt themselves, but they're also a higher risk for us and our personnel. So where we meet those intolerant individuals, can we ever help them shift to becoming more tolerant of us? There are a variety of ways, and we're going to flick through some of them, but actually a lot of it comes from what goes on outside the veterinary practice. So it is about preparing the individual in advance for what we're going to do. And that's why the emotional wellbeing page has some specific resources for that and what caregivers can do. Because we can only do so much within the consultation. That preparation is absolutely going to be key. And it's often better if it's done by familiar individuals. And then we find a way of blending that back into a clinic setting.